Welcome to Cancer Buzz. On this episode, cancer immunotherapy and its impact on emergency department providers, and what oncology can do to help emergency staff get the information they need.
We're trained really well in picking up the traditional toxicities and the traditional oncologic emergencies. However, with the new immunotherapies that are coming out, many are not aware of what to look for at this point in time. And I think that that's a really great area of improvement where emergency physicians can work with oncologists, especially at the community level, to improve our treatment of the patients overall.
This is Cancer Buzz. I'm your host, Summer Johnson. The cancer care community knows how revolutionary cancer immunotherapies are. However, as these treatments continue to evolve and indications expand, patients treated with immunotherapy touch healthcare providers who may not be as familiar with these treatments and their effects. In emergency departments alone, patients with cancer make up 4% of visits. A 2017 study found that 10 to 12% of patients with cancer visit the emergency department at least once during treatment. As new immunotherapies are approved and more patients are treated with them, even more patients will present to emergency departments with immune-related adverse events during their treatment, or even months and years later. What's more is that these patient complaints can be very subtle and mimic other common issues, and that presents a new and unique challenge for emergency department providers. In addition to clinical information, emergency providers simply need to be made aware that their patient has been treated with immunotherapy, something which may not come to mind for patients, according to our guest. Dr. Sarah Dubbs is an assistant professor and the assistant director of the Emergency Medicine Residency program at the University of Maryland School of Medicine. We spoke with her about this information exchange and how the cancer care community can better work with ED providers.
I am a board-certified emergency medicine specialist, so I am not trained formally in oncology. However, that's one of my main academic areas of interest, so that's where I do my writing, speaking, and publishing. I got into this because I'm involved in residency education for our residents that are training in emergency medicine. And personally, I am interested in oncologic emergencies because it's affected my family a lot. So I have many family members who unfortunately have gone through the process of being treated for cancers, and it's just a population that means a lot to me.
Walk us through what the emergency provider might generally assume when a patient with cancer presents him or herself in the emergency department.
We're seeing more and more cancer patients in our emergency departments, and so it's becoming a population that we really need to pay attention to. And with the velocity of changes in new medications and new therapies, I think it's very important for emergency physicians to be aware of that. We're trained really well in picking up the traditional toxicities and the traditional oncologic emergencies. However, with the new immunotherapies that are coming out, many are not aware of what to look for at this point in time. And I think that that's a really great area of improvement where emergency physicians can work with oncologists, especially at the community level, to improve our treatment of the patients overall.
Do you think that ED providers at this point in time, in 2019, generally assume that when a patient comes in and they have cancer, they have been treated with chemotherapy? Does immunotherapy even cross their mind at this point?
I think for the average emergency physician, immunotherapy is not really on the radar yet. And it's unfortunate to say, but I think that at the same time, we are getting much better with it. And there are efforts in the emergency medicine community, as well as coming from the oncologic community, to educate everyone about these. And so what I've done is kind of make that my area of expertise. And we're doing a lot of writing as well as research and collaborating with folks in the oncologic community to educate ourselves and to learn more about what we can do in the emergency department setting to recognize as well as treat the toxicities of immunotherapy.
Then what might they assume now when they are told that the patient has received or is receiving immunotherapy for cancer? Are emergency providers unsure in their own knowledge base when it comes to these new treatments?
One of the things that's most important first for emergency physicians to recognize is that it is really important to ask about the specifics of a patient's therapy. So when I have a patient that comes into the emergency department, or I have a resident who's seeing a patient, they might come and tell me they are seeing Ms. Smith, who has lung cancer and is on therapy, and she's presenting with shortness of breath, fever, what have you. However, when I ask further of that resident what kind of therapy the patient's on, they kind of either assume that they're on chemotherapy or just never asked and have no idea. So I think that step number one for us as emergency physicians to do is to recognize that there are multiple modalities and new modalities and to ask patients of those. Number two, I think that it's important, and I can see from our side of things, is that patients might not be aware themselves. And those of us that are lucky enough to have EMR that's associated with the same place where patients are getting their cancer treatment can see that in the computer. But even so, if you don't know that it's there, you don't look for it. And then if you work at a site that the patient is not getting treated at, or you don't have as robust of an EMR system, you may not be aware of the actual regimen that the patient's on and what to look for. The other thing that's helpful from the oncology side of things is to really work with and educate the patient when they comes into the emergency department to tell their doctors that they're on some kind of special treatment. Even if they don't remember the specific names or anything like that, they can tell them to let them know or show them a card that they're on a specific regimen or they're on special medication, etc. And we always do appreciate a call from the office if they know that a patient is headed in who's on active treatment and what to look out for and what you're concerned about.
So when it comes to treating the emergency presentation, can you give us an overview of the challenges that come with learning a patient's been treated with IO, from identification and diagnosis to then treating them?
Challenge number one is just awareness. And again, it's something that we need to work on from the emergency medicine perspective, and to be able to recognize again and ask and look for this in the EMR or directly from the patient. It's really nice when the patient's primary oncologist calls and lets us know that they are concerned for specific things or that the patient is on IO treatment. But again, number one, the challenge is awareness right now. Number two, it is lack of awareness about the specific mechanisms and reasons why we would be worried about other things than the traditional febrile neutropenia and things like that. So I think, again, communication between the communities of emergency medicine as well as oncology is really important, and will break down those challenges.
Are the patients remembering to tell emergency staff they've had immunotherapy treatment for cancer? Is it reliant on the patient and the caregiver right now, or are they asked during intake whether or not they've had IO treatment?
In my experience, many patients who I know that they are on immunotherapy before going into the room still say that they are on chemotherapy. So I think again, I know that their oncologists are putting in a big effort in terms of letting them know that they are on special therapy and on immunotherapy. However, when I go in and I ask them what kind of therapy they're on, they will tell me that they're on chemotherapy, even though I can look in the record and see that they are not on chemotherapy. And some patients are on combination therapy, and that's fine too, but they'll forget to mention that they're on combination between traditional cytotoxic therapy as well as immunotherapy.
Wow. Okay. So are emergency providers as informed in immunotherapy as they want to be? Are they receiving education about IO on a regular basis? How do they feel?
The emergency medicine community is especially starting and engaging in education regarding immunotherapy. So it is very popular to have lectures and podcasts as well as papers in our specialty journals about this. So people are getting education. It is definitely something that is spreading and is continuing to be more popular and on the radar for emergency physicians.
How are you educating your residents at your program about IO-related adverse events?
At our program at University of Maryland, we're integrating education about adverse events with IO into our specific HEMONC curriculum. And I think that that's something that's not special just to our program. It is being incorporated into the overall curriculum expectations for emergency medicine in general. So I think that very soon we'll start to see it part of the standard curriculum that's expected in the core curriculum, and it will be appearing on our specialty boards as well.
Considering that the emergency providers, they're a very unique group in terms of their needs, and coupled with the fact that immunotherapy for cancer is evolving so rapidly and emergency departments will start to see more and more IO-treated patients, how do you think the oncology industry as a whole can move toward better education for these doctors and nurses so the patients can be managed effectively?
It's definitely going to require a huge amount of collaboration because, of course, we're not the experts on IO therapy, but we will see these patients come into the emergency department. And again, you might be treating someone at a community or a major cancer center who will show up to a freestanding ED or to show up to a rural ED that's maybe not as connected with the oncology community. And having collaborative educational resources like this podcast and through other societies is really important in getting the word out from there. So I thank the ACCC for inviting me, an emergency physician, to be on this podcast and not having, any formal training in oncology, but having a very big interest. It is a really wonderful step in terms of collaboration and getting the word out there to different areas that patients will encounter during their course of treatment and even post-biotherapy.
What are some of the tools being developed for this information exchange?
SITC has developed a collaboration with the American Academy of Emergency Medicine, which is one of our main academies in our specialty. And they are working together to put out educational sessions and days, as well as increasing our focus in terms of our journals, podcasts, as well as other forms of communication, emails, etc., newsletters, with increased attention to oncologic emergencies in general, as well as immunotherapies.
We've talked about communication from all sides. What's the best model that you've seen in terms of communication between the treating oncologists, patients, and emergency care staff, both on the active care team and in the survivorship care team?
A model where when the patient is concerned and thinks that need to be seen urgently or emergently, and they're able to call their primary oncologist and speak with someone on call, whether that's a kind of triage nurse or on-call nurse or the physician themselves prior to coming into the emergency department for evaluation, is really wonderful. And that way they can kind of be screened and it can be determined whether or not it could wait until clinic hours or if they really do need to come in immediately. It's really great because from the emergency department side, we are often overrun with patients and overcrowded. And the last thing that I want is for a cancer patient to be waiting in the emergency department waiting room for, it could be hours until we have a bed open. And we, from the emergency department side, ideally, I would love to get my cancer patients back into a room and immediate treatment started and evaluation started immediately. However, that's not always the case just because we are so overcrowded with patients. So when a patient can speak to a provider before coming into the emergency department to determine whether or not it could wait is important, and also kind of giving them expectations of what to expect when they come in. We want to get them straight back, but sometimes that's not ideal, and preparing a patient for that is really important as well. For anyone that's listening that is a primary oncologist, give us a call, talk to your local emergency medicine group, and have an open discussion and, talk to them about coming in to inform the group about your patients and get on the same page about, what these patients need in terms of their workup, in terms of communication and all that, and keep the lines open. We really appreciate it.
A special thank you to Dr. Dubs for giving us her insight today. You can find the research and resources discussed today in the show notes. Thank you for listening. We hope you find this show useful and that you'll share it with a colleague. That helps us grow our audience and create more podcasts for you. Don't forget to subscribe in your favorite podcast app to get future episodes delivered right to you as soon as they're released. Next time on Cancer Buzz, we take a look at the front lines of cancer care and how one oncologist in rural Montana stays connected and informed while providing quality cancer care to his patients. Until then, for the entire Cancer Buzz team, I'm Summer Johnson. Thank you for listening.
Cancer Buzz is a resource of the Association of Community Cancer Centers.